On average, how many syringes of Juvederm needed? How many syringes to achieve the photo I edited, to make my top lip more proportionate to my bottom?
Thank you for your question. You submitted a photo and a photo which you have enhanced your lip and you're asking a question, how many syringes of Juvederm would you need to get the kind of result that you desire with the photo that you retouched? Well, certainly I can help you with this. I'm a board-certified cosmetic surgeon practicing in Manhattan and Long Island for over 20 years. I am also a licensed provider of the Y-Lift, a non-surgical structural volumizing facelift solution using fillers such as Juvederm and Voluma. And you can be sure that we use a lot of hyaluronic acid fillers for procedures such as the Y-Lift. And so I can give you a certain perspective as to how I answer this question when patients come and ask us this type of question, which is something we deal with every day. So when you look at your lips, and I think that certainly you're on the right track about trying to balance out your upper lip to the lower lip. You know, in aesthetics, we use terms such as golden ratio, or phi, the golden ratio of 1.6 to 1 in various areas of the face. There's also another ratio where we compare the upper lip to the lower lip, and it's kind of a 1/3, 2/3 rule, where the upper lip is a certain volume and then the lower lip is almost double that volume, but it has to look right and aesthetic. Now, when people do these types of photos, the one thing that you have to be mindful of is the three-dimensionality and the tissue spaces that are augmented. So, although we try to get the balance, you can't expect that it'll be exactly like the photo. Anatomically speaking, the lip has essentially two areas which we can augment with hyaluronic acid filler. Technically a little bit more when you think slightly above the lip, but there's the vermilion border, which is the border along the lip, which you typically would use to enhance with lip liner. And then there's the pink, or the body of the lip, which when you augment, you want to augment very artfully. So many of our patients who come to see us for the first time will say, I don't want to look like a duck, I don't want to look like whatever, and they'll name the celebrity that you could think of, and they don't want what has been often referred to as trap pout. So whenever a relatively young patient comes who wants to have some type of augmentation, I'll usually start with just one syringe. And the reason I do that is that very often with younger people, the border of the lip, the vermilion border, the area which I refer to as the lip liner, can be very well augmented and defined and create the perception of fullness. So there's a lot of art to doing this. For other people, we'll put some of that syringe into the pink part of the lip to try to get some balance. The one thing that I have to mention is that one syringe is basically 1 cc, or 1 milliliter. That's basically the equivalent of a baby teaspoon. The more volume you need, the more syringes you need. So sometimes we have to go into 1 to 2 syringes in order to get the best result. But as I explained to many of my patients, and what we normally do is we see our patients after 2 weeks to see how they look in case they need any enhancement or anything else, we can always add. It's possible to subtract because there is an enzyme called hyaluronidase which can be used to dissolve, but that's something we don't want to do. We would rather be conservative the first go around and then add later on. That's a personal style. So you could probably be safe in starting with 1 syringe, and then you can always add beyond that. So meet with doctors and learn about their style and learn about what you think will be the aesthetic that makes sense to you, understanding that just a two-dimensional photo can't really be fully representative that you draw on of a three-dimensional human being, a facial structure. So I hope that was helpful. I wish you the best of luck, and thank you for your question.